Speaking.
Yeah, hi, nice to meet you.
Nice to meet you. My name is Sarah, and I'll be your interviewer today.
Wonderful.
All right. Do you mind if I start out asking you some questions?
No, of course.
All right, awesome. Can you describe the phlebotomy process?
I can. So the first part would probably be preparation. So you want your equipment already prepared, organized, ready before you greet the patient. The next step is going to be patient identification. You want to greet them, introduce yourself, make sure you get their full name, date of birth, kind of give them what they can expect, how long it's going to take. Next is going to be vein selection, so gloves, tourniquet. You're going to choose the vein based on size and condition. Remove the tourniquet, disinfect the area. Going to select your equipment based on the vein that you chose. Once that's all put together and the site has dried, you're going to re-tourniquet, anchor the vein, insert the needle, fill the appropriate tubes for the tests that were ordered. Once those are full, you're going to pull the tourniquet, remove the needle, apply pressure, engage the safety. If the patient is able, I would ask them to hold pressure over the site. While they're holding pressure, I would label the tubes, have them identify and make sure that it is them on the tubes, and then wrap them up, thank them, escort them to the door. When I came back, I would then make sure that the specimens made their way to the lab based on the facility's protocols.
Good. Sounds great to me. How do you handle difficult or anxious patients?
So when I have handled anxious patients, I think that the biggest thing is typically really listening to them, showing empathy, validating their concerns. The first thing I like to do is kind of ask them, why are you anxious? Address what is the main concern here. I think a lot of times hearing them out, them getting to say it out loud is helpful, and then I can better address the things that are making them nervous. So I can explain the process, help them understand what they can expect, sort of walk them through that so that they feel a little bit more in control in a situation where maybe they feel like they had lost that control a little bit. I do think sometimes that doesn't work. You need to kind of have them take those deep breaths, keep the oxygen going in, maybe try to distract them with conversation, just sort of get their mind off of the things that are making them anxious. But I think no matter what, the approach has to be professional and patient and kind and empathetic, because we don't know what they're going through.
That's an excellent answer. I like it.
Thank you.
Yeah. How do you handle stressful situations or a high volume of patients?
For myself, I found the best way to manage times where there's anxiety or a lot of pressure, a lot of things need to be done. I always kind of have the same process. So my brain is going to go to the same way of doing it every time. I am going to be looking at those tests and prioritizing based on, what is stat, what is timed, what is routine, and organizing them accordingly. The next step is going to be time management. So I'm effectively using my time to get those tests, those specimens retrieved and test off to the lab in the fastest and safest way possible. When I find that I don't have the time to get it all done myself, that's where I'm going to rely on coworkers and be able to see situations where I maybe need help and say, let's divide these up, delegate some of it to make sure that patient care is the priority.
That's very well put. I like it.
Thank you.
Okay. What made you choose a career in phlebotomy?
So I do think that phlebotomy is a wonderful way to make a difference and to help people. I also think there's quite a bit of job security in healthcare. Beyond that, I'd say the thing that really solidified it as a career for me was just this last summer. My daughter was diagnosed with a very rare reaction to E. coli, and it caused her to go into renal failure. And she had to be life flighted up to Randall's Children's Hospital. And during the whole process, we were kind of moved around from different facilities and different labs. And she got poked maybe every hour, it seemed. And there were plenty that were good, and then there was a handful that were not the best experience. So some of them didn't speak to her or address her as the patient when they would come in. They would speak to me, even though she's the one going through it. Or maybe their technique was not good, and it was more painful than it needed to be. And by the end of it, I just kept thinking, man, I feel like I could do better at that, or I'd approach that better. And then I thought, I think that's what I want to do. And then once I really went through it and I got the training, I really enjoyed it.
That's a great answer.
Thank you.
Can you discuss your experience with different blood draw techniques and equipment?
Of course. So as far as equipment, I have used standard ETS, butterfly, syringe, capillary puncture. I have familiarized myself with ABGs and heel sticks, although I haven't had the opportunity to perform them. But with that equipment, I have used it on a variety of veins. So, of course, the standard, antecubital area on the arm, but also hands and wrists and knuckle veins and deep veins, shallow veins, little surface veins, or forearms. Basically anywhere that I could safely take blood from somebody, I have done it, because I feel like it really is the best way to prepare myself for any situation that I might find myself in.
That's a really good put forth answer.
Thank you.
And I think that I will conclude this interview. Your resume looks great. You collaborated well on your resume with the questions that I asked, and it seems like you're very true to your word, and I appreciate your time in this interview.
Thank you so much.
Yeah, I hope you have a great day. It was nice to meet you.
It's nice to meet you too.